Skin Games judges. For this week's video, we're going to focus a little bit deeper on a couple of the IV therapies that we've added as part of our case study. Even though we've done 4 different IVs, there's 2 that I really want to kind of focus on. So those being alpha lipoic acid, or ALA, and glutathione, and how working these 2 together can actually provide enhanced benefits when it comes to reversing cellular aging, reducing the depths of fine lines, wrinkles, and really getting that cellular protection. Alpha lipoic acid directly affects cellular metabolism by improving mitochondrial function. It enhances glucose utilization and therefore prevents glycation. It does this by repairing glycated proteins. It aids in repairing damaged cells, reducing inflammation, and minimizing the depth of fine lines and wrinkles. It improves texture and tone by directly affecting the cellular processes. On the flip side, with the glutathione, this is a tripeptide that plays a crucial role in protecting cells. It enhances antioxidant defenses, promoting detoxification and repair, while serving as a tyrosinase inhibitor and a natural skin brightener. By combining the alpha lipoic acid with the glutathione, we are preserving telomere length, reducing cellular aging, and protecting from free radical damage. As we enter into perimenopause, menopause, and postmenopausal skin, we really have to focus on the cellular aging. By neutralizing free radicals, these antioxidants will prevent the breakdown of collagen and elastin that can be caused by free radical damage. The combination also will help with the extracellular matrix remodeling and MMP regulation to regulate the collagen breakdown.